So I'll give the titles and then I kind of explain what that means. So I tend to be more experiential. There's a new wave of therapies in the last 10 years that are pretty different. Well, they build on, but are also diverge from the traditional old school forms of therapy, whether that's more analytic or CBT or that kind of thing, that are more focused on like the experience, like wanting people to have an experience that's what's going to be healing. And they're really using things like mindfulness, dealing with the emotion directly rather than just looking at the thoughts. Some of the previous therapies may be a little bit more heady, either looking at the thoughts or making insights but stopping short at insights, rather than really helping people come in contact with their feelings in an empowered way, having a new experience of themselves and their emotion and relationship. So in these new ways of working, it's very experiential, it's very in the here and now. It's not too much storytelling. It's almost like we're meditating together. It's like I'm really tracking, okay, then now what happens, versus getting caught in like problem solving something on the outside or hearing a bunch, like just talking. And also I'm really present as a real person. So like I care, I'm invested, I'm able to share about myself, if they want to know, or if I'm feeling moved, I'll tell them. So I'm really like emotionally like connected as a real person, like not like a distant person. A lot of people who come to me also have found that they've been in therapy, but that their therapist just kind of like listened or kind of nodded, or I nod too, but they just listened and didn't do much. And some people really like that, but how I approach it is I'm more engaged. I'm sort of an equal, I'm really like we're in it together. I'm guiding and coaching quite a bit, even though what I'm coaching and trying to follow is their internal experience. So it's directing it toward them, but yet I'm helping that go there, helping them slow down, for instance, rather than do the defenses, of talking and, going and thinking outside. So that takes a little bit of practice internally. I think it helps when therapists have their own mindfulness practice or have done their own therapy so that they internally know how to slow down and are really comfortable with like the whole range of human emotion, so that they're kind of communicating that, So if you want the titles, what I do is called Accelerated Experiential Dynamic Psychotherapy is a foundation. Then I also integrate with that somatic experiencing, which is an approach with trauma, but it actually can be used with everybody. It's like one, because we all have trauma, but also it's just like a really nice way of working with the nervous system. They're very similar in some ways because it's all about mindfulness, slowing down, regulating, learning emotional regulation. And then with couples, I use PACT, which I mentioned, psychobiological approach to couples therapy.